Hello, my name's Vinod Patel. I'm one of the GP registrars here.
Okay.
So I'm just going to find out a little bit about the problem that you've come in with. Would that be all right?
Oh, yeah, that's fine.
Just
Yeah.
going to make some notes, and basically this will just help me write it up onto the computer later on.
Okay.
So just in your own words, tell me what's brought you in today.
Well, I've been getting some diarrhea, really.
Mhm.
Yeah, for the last sort of, 2 or 3 weeks.
Okay, so before 2 or 3 weeks, no problems really?
So before that, no. I mean, I've just been going normally, which is once every couple of days or something. Yeah, no problems normally.
Okay, so just tell me a little bit more about the diarrhea, what it's like and things like that.
So like what my poo looks like, sort of thing. Okay, so it's quite it's runnier, sort of looser than normal. I don't think there's any change in like colour or anything. And I'm probably, but I'm just going a lot more often.
Can I just check, do you have any blood in it at all?
Oh, gosh, yes. I'm surprised I haven't said that already. It's worrying me. That I've had for a couple of days.
And is it difficult to flush away at all?
No, it's not difficult to flush away.
Yeah, and do you ever see any food that's not digested properly in it?
No, that wouldn't be something. No. No.
So you said diarrhea, but how many times a day does it actually happen?
Well, I would say somewhere between. Well, at the moment, probably somewhere like yesterday was probably about 8 times.
8 times,
Yeah.
dear.
I mean, I don't think it's been like that every day for the last 3 weeks, but
up to 8 times
up
a
to
day.
8 times, yeah.
Do you have to get up at night to go to the toilet?
Yes,
Oh dear.
yeah, and I've never had to do that before.
And you're losing sleep over it?
Oh, yeah.
And do you have any tummy pain at all?
Yes, it's quite sort of crampy, mainly just before I go to the toilet, but it can be at other times.
But then does that pain go away once you've been to the toilet?
Yeah, a little bit. Yeah, I would say so. A little bit.
And does anything make the pain worse at all?
Just eating. I don't. Not that I can really think of.
And you pointed to your tummy. Exactly where is it?
It is just sort of around the middle, really.
Yeah. And how do you describe that pain?
It's sort of crampy.
Crampy
I guess.
is what you said, isn't it? Yeah. And how bad is it? If 10 was excruciating and 1 was very little pain, then where would you put it?
It's not. Yeah, I've had worse. So probably about 4.
Yeah. So it's not agonising, but it certainly is there.
Yeah.
Okay. And you've told me about when it comes on and what makes it a little bit better and worse as well, which is good. So I'm just going to ask the rest of the questions just about the whole gut itself. Do you have any difficulty chewing your food at all?
Oh, no.
No mouth ulcers or anything like that?
No.
Any difficulty swallowing your food at all? Do you ever get indigestion?
No.
Not really.
Well, sometimes, maybe on a weekend. Sometimes.
Okay, but not usually.
No, not usually.
So this was only about 3 weeks ago that you've had the problem.
Yes.
Okay. And prior to that, what was your bowel habit like?
I don't go that often, really. It's sort of maybe once a day, once every 2 days.
Once a day, once every 2 days, but certainly no diarrhea.
Oh, no.
And a normal form stool.
No, it's quite harder, if anything.
But no blood, not black at all?
No.
Okay, that's great. Thank you very much for that. So just want to ask you some questions about the other systems of the body. So do you get any headaches, fits, faints, blackouts, anything like that?
I occasionally get headaches, but everyone gets headaches, don't they? And I've been getting them for a few years. So
a few years, yeah. And they're not getting worse at all or anything like that?
No.
Okay, that's good, any problems with breathing? Shortness of breath, cough, anything like that? No. Any chest pain?
No.
Do you ever feel your heart having extra beats?
No.
Any swelling of the ankles or any difficulty breathing at night?
No.
Nothing like that at all. Okay, you've told me quite a bit about your tummy. So any muscle aches and pains at all?
I sometimes get like sort of weakness in my arm with the headache.
All right, so you get weakness, but how long does that weakness last for?
Oh, only about an hour.
Okay, any skin problems at all?
I've had a sort of a little bit of a rash that comes and goes a bit.
Yeah, do you know what that's due to?
No.
No? Okay, but no joint problems?
No joint problems.
Any problems with the waterworks at all?
No.
No. And can you tell me about your periods, if you don't mind?
Yeah, well, I'm on the pill, actually. The I don't know what it's called, but the one, I take it for 3 weeks and then I have a week off.
Yeah.
So I get my period in that week.
So the regular?
Oh, yeah.
And they haven't changed at all?
No, I've been on that for years.
So just a final check on your symptoms. So you've told me there's a little bit of blood in the diarrhea.
Yeah.
Okay, and is that every time you have the diarrhea?
It's only been the last couple of days. That's what's worried me.
Okay.
And probably not every time.
But you're not coughing up blood, nothing like that?
No.
Okay, no lumps and bumps anywhere?
Not that I'm aware of, no.
And what about weight loss and change in appetite? I wanted to ask you.
Well, I think I probably have lost weight, actually, in the last few weeks. My trousers definitely feel a bit looser.
You don't know how much weight you've lost?
I don't really weigh myself, so no, I don't. I mean, yeah, it sort of overlaps a bit now.
Okay, so a little bit of weight loss anyway. Okay, so that's fine. Now let's move on to your past medical history. Any operations in the past at all?
Yeah, I did when I was sort of in my teens, probably I think I was about 15. I had my appendix removed.
In your teens, okay,
Yeah.
but nothing since then? No big operations since then?
No.
Okay. You said that you take a little bit of paracetamol for your headaches?
Yes, yeah.
Okay. And are you doing any of the medicines at all?
Just the pill. Yeah. No, nothing else.
Nothing else at all? Okay. And nothing else over the counter?
No, just paracetamol for my headaches.
Any recreational drugs at all?
No.
Okay. And are you allergic to anything?
Oh, yes. I'm allergic to amoxicillin. So is that penicillin?
Yeah.
So we're allergic to penicillin.
Okay. What happens when you have penicillin?
Oh, that's what I get. That's when talk about a rash. I get a rash.
Oh, I see. So that's the rash.
Well, no, but yeah.
Yeah. Okay. So rash with penicillin. So do you avoid penicillin?
Yeah, absolutely. I've only had it once.
Yeah.
Well, as far as I'm aware, I've only had it once.
I checked that you've had only the appendix operation, but no other serious illnesses.
No. Well, no, not serious. No.
Okay.
No.
Okay, that's fine. Thank you. So, just want to move on to your social history, if you don't mind. Can I ask you, are you working at the moment? Or?
Yeah. I'm a teaching assistant.
All right. Do you enjoy it?
Yeah, I do. The kids can be a little bit of a nightmare sometimes, but on the whole, I really
So,
like
how's this condition impacting on your work?
Well, I haven't really known where to go in, to be honest, because if it's infection, I don't want to pass it on to the children. So actually, I haven't been going in the last sort of couple of weeks.
So you're worried about the fact that you might pass it on
if
to
it's
someone.
an infection, because you're supposed to be clear, aren't you, for like 48 hours?
48 hours, yeah.
So I don't really know what to do about that because I've gone past,
And do you smoke at all?
No, not
You've
now.
never smoked?
Oh, I have, yeah. I smoked at college, yeah.
Yeah. How many did you used to smoke?
About 10 a day.
About 10.
Yeah.
And how many years was that for?
I smoked for about 3 years.
3 years, okay. That's your smoking. What about alcohol? Do you drink alcohol at all?
Not that much, really. I drink at weekends.
So what would your typical intake be in a week, do you think?
In the week, probably nothing. And then at the weekends, one night I tend to go out with my friends or my partner, and so I might get through a bottle of wine and maybe a couple of shots or something.
A whole bottle of wine?
Like that. I think so. Probably over the course of the evening, and then on the other night we might just have a couple of glasses of, share a bottle of wine.
I mean, that sounds as if it's more than about 20 units, roughly.
Right.
Because a bottle of wine would be about 8-9 units.
Yeah.
And then you've got the other half bottle and a few shots. So that's about 20 units, which is excessive, I have to say.
Yeah.
And the fact that you have more than what we call 6 units, which is just over half a bottle in a single session, can cause disbenefits to your health, as it were, can harm your health in the future. You may need to talk about that. Would that be all right?
Yeah. I mean, obviously, I don't want to. That's why I'm here.
So. Sure. We'll concentrate on the main problem. So, who's with you at home?
So I live with my partner, Sam.
Okay. No particular problems there at all.
No.
Okay.
We've been together about 3 years.
Is there any family history of note?
No, not that I'm aware of, anyway.
No gut conditions in the family?
My aunt, maybe. My aunt had something to do with her tummy, but I don't know what it was, really.
Okay.
It wasn't cancer.
So just moving towards the end, I just wanted to explore your ideas, concerns and expectations, really. So what do you think is going on with this problem?
Well, I think it could be an infection.
An infection, yeah. And you told me about one of your concerns about
passing
it on to people at work, and especially the children, I guess.
Yeah.
But any other concerns
Well, they pass on to me.
Yes.
My friend's sister has got bowel cancer, and she's only 30.
Oh dear.
And so it's just the bleeding, really, more than anything that's worried me. So I wondered about that, really.
I mean, I'm glad you told me that. We'll try and reassure you, and let's see what turns out in your case. What do you think we need to do today to help you?
Well, I wondered if I might need some tests. I mean, I'm really hoping, because I did have a little look on the internet, and I'm really hoping it's not going to be one of the cameras. I think it's colonoscopy or something like that. I'm hoping I don't have to have that.
Sure. Okay, I think I've got everything there. Is there anything else that you want to tell me? Actually, I've just remembered, I forgot to ask you about travel. Have you had any travel in the last few months or weeks even?
No, I haven't been away anywhere.
Okay,
no.
And you can't distinctly say that this is due to a particular food that you've had, and nobody else has had this problem in your family?
No.
Just wanted to check that.
Yeah.
Okay, so is there anything else that you want to tell me about this problem?
No, I did go travelling about 3 years ago to Africa.
All right, 3 years ago.
Yeah.
Okay.
I went to South Africa and up into Zimbabwe.
But were you well there, though?
Yeah, I was well. Yeah.
Okay. And do you have any questions for me?
No. How likely is it that I'm going to have a camera?
Well, I think initially we'll probably run some blood tests and do the stool sample, and make sure there's no infection. Then I probably need to get a gut specialist to have a look at you if it hasn't got better in a matter of weeks, and then we'll take it from there.
Yeah.
But let me just summarise what's been happening then. So you've had this problem for about 2 or 3 weeks.
Yeah.
It is distinct diarrhea, around up to 8 times a day, sometimes overnight as well.
Yeah.
You have to get up to go. You've got cramping abdominal pain, tummy pain, and you've got some blood in the motions as well. There's no real past medical history apart from a little bit of migraine, you said, and the appendix. You don't smoke at all now. Alcohol, we may need to talk about it later on. A little bit too much there, I think. But you're worried about this because somebody had bowel cancer, and you're a bit concerned about an endoscopy as well.
Yeah.
But would it be all right if we ran the blood test today and did the sample? And then I can see you again.
I want to get on. Yeah, I want to get it.
And then maybe I can see you again next week then.
Yeah, absolutely.
Okay, right then. Well, thank you very much.
Okay, thank you.
Thank you.